Hi, in this video I'm going to talk about ankle sprains and what you should be doing to ensure that you get back to full health and full strength after you sprain your ankle. Now, ankle sprains is one of the most poorly managed injuries that I see here at the clinic. Often people sprain their ankles and they do two things. They either do nothing at all or they do nothing for a couple of days and then they go back to full activity again. And they're missing out on a vital bit of rehab in the middle that progressively loads that ankle after the injury to ensure that when they go back to full strength or full activity, that the ankle is able for the loads and that there's not another joint compensating. So if you think about it, when you sprain your ankle, your body's initial reaction is to protect the area. So that's going to involve some swelling and some inflammation, which is perfectly normal and perfectly natural. It's needed for all the cells, the inflammatory cells, to come in and to clean up the area. But we don't want that there too long. When there's inflammation there for too long, it starts to irritate the rest of the tissues and that can lead to other stuff and it can prolong the injury. So inflammation for the first few days is okay, but then we want to get that inflammation away as quick as we can. Okay? So from then, after the inflammation is gone, we want to make sure that your range of motion is back so that you have good range of motion. Now when you're walking or when you're running, your body wants to be able to come over your foot like this, and also you need to be able to plant your heel on the ground when you're walking as well. So you need good dorsiflexion, good plantar flexion, which is pointing your toes up, pointing your toes down, and then you want some side to side movement as well. So the way we do that is through some hands-on techniques and also some exercises that you can practice at home. So once you have that good range of motion back, you're not getting any nips or any pinches around the ankle, then we want to look at progressively loading your ankle. So after an injury, you've got all these muscles running down here, either side of your calf. They're coming down, they're attaching around the ankle, they're going into your foot. So they want to all be strong enough and they want to be working well together. Often what you get is people are quite good at pushing through one side of the foot. So you have the ball of your big toe and the ball of your little toe, and you want to be able to push through both of those as you're pushing off. And quite often you'll get people are good at pushing through the big toe, they don't use the ball of the little toe a lot, or sometimes vice versa. So we want to make sure that you're able to push off and do, say, a calf raise or a heel raise where you just push up on your heel, that you're able to get up nice and high and that you have good strength. So you're able to do 10 of those nice and strong, nice and fast, without any hesitation or any apprehension. So once you have good strength there, then we want to look at progressively loading it, and this is the part that a lot of people miss. So what happens to a lot of people is once that pain is gone and once they're able to walk and they feel okay, then it's back to running straight away. And running is a lot of activity on the ankle, so there's a lot of force going through it when you land on that foot. And if you go back there running too soon, your ankle does not want to accept that weight yet. So what is going to happen is that the other joints are going to compensate and you're going to have to work harder. If you imagine it in your work situation, so if you're working and if somebody is not working too well because maybe they're feeling a little bit unwell or they're a little bit lazy or something, then everybody else is going to have to work harder to pick up the slack for those. So it's a little bit like the same like the body as well. So often the muscles around the knee, around the hip will not be loading properly, or they'll have to do extra work to compensate for the ankle not being able to work the best way as it should. So that progressive loading then is very important, and this is all before you go back running. So that involves hopping. Can you land on the ankle properly? Can I hop? Can I land? Can I stick? And then am I able to change direction? So of course it depends what you need to be able to do. If you just want to go back to walking the dog, then that's mainly straight line stuff. If you're a long distance runner, same enough, or same situation, mainly straight line. But if you are going back onto a playing field, you need to be able to run, but you need to be able to stop, twist, turn, push off in different directions. And it's important that your ankle has been exposed to that before you go back to the pitch. Okay, so that's the really important part that a lot of athletes, amateur athletes, do not do properly. They go back to the pitch too soon, and then maybe a couple of weeks later they find their hamstring is flaring up, or their hip or their quads or something else is flaring up, and they're wondering why. It can definitely be traced back to that ankle injury that happened a couple of weeks earlier. Okay, so if you want to see some of them loading progressions, check out some of my other videos. I go through some of the hopping progressions that we use, and you can see them there. It's really important that that is done properly. After an ankle sprain, you should, if this is all done properly, you can be back in the playing pitch pretty quickly, okay? It depends again, of course, on the severity of the sprain, but if you follow the correct procedure and if nothing escapes, then when you go back to the pitch, you should be 100% ready to go back without any hesitation or any apprehension. Okay, so thanks for watching and we'll see you in the next video.